Sanibona, igama lami Dr. Mlungisi Dongwe. Today's topic is about iron deficiency. Okay, I had a patient, just some of the very severe presentations. Sometimes my patients can present with iron deficiency anemia. I had a patient actually who was presenting with symptoms of feeling weak, maybe emsebenzini usazile ezizwe nje ukuthi nje uyazamula akukho umsebenzi osila ngakwazi awenze ngoba uzizwe ekhathele njalo ejothena mhlawumbe ngoba there's a lot of stress at work, and that could be the reason for her always being tired. Sometimes when patients are complaining about periods, especially abantu besifazane, they'll have periods which are very heavy and last longer than normal, and then you find ukuthi ngalama periods mangabe enzeka are heavy than normal, and uthola ukuthi i-period from the time makade umuntu esikhathini till the next time akudluli inyanga. Actually, they might find themselves going the period more than twice or three times in the same month because of deficient iron egazini. So it's a vicious cycle where you find the lower iron you've got, or HP when it's lower, you tend to bleed more and you lose more of your gas. So tiredness, some people can have severe headaches. I've had a patient who presented actually having blurriness of vision, and it's becoming very severe. We were actually contemplating what is somisa what's causing her to not be able to see very well, until we found that HP was very low due to iron deficiency anemia. So for her, she needed to be transfused, and then my symptoms resolved. Then very recently, I had a patient who I'm calling the sponge eater, and she says that one notice I know sofa, the part lay sponge sofa, and also in one of the residents were almost deformed because of how much his sponge is in fact, even in a canister pills sometimes even a sponge to try and keep moisture out, sponge before athatha amaphilisi akhe. So it's a very important condition. Abantu besifazane, we see badla ukhetho noma bafuna ukudla isihlabathi. That's another sign. It's called a pica, where umzimba usukune desire ye-iron, and you feel ukuthi khona into esithile ethi ungabe uzidla uzizwe ngathi uthi ziyakhwentsha noma ziyagculisa lesiya sidingo sokunaso emzimbeni wakho. So it's quite important. It's a very common condition abantu besifazane abaningi. Tiredness all the time, heavy periods, and you can have symptoms such as having desire to eat abnormal things just because of the iron deficiency anemia that they've got. So it's very important. It's very easy to treat once it's diagnosed. Supplements, and within a few weeks, the desire to be eating all of those abnormal things like soil and slabat and keto and resolve. The only other challenge is that iron supplements can cause constipation, and some people can and iron supplements. So a lot of people tend to just for and then only to find it but then symptoms again. So Dr. Dongwe, Luminjalo Medical Centers, siyabonga ukulandela uhlelo lwethu.